Hey everyone. I wanted to start this video with a, a quote that I found. This is from Islam Question and Answer. The question is, whether or not it is haram or halal to keep dogs, and I thought this answer was really good. With regard to keeping dogs, this is haram, and is in fact a major sin, because the one who keeps a dog, except those for which an exception has been made, will have 2 qirats deducted from his reward every day. Uh, and to note, the exceptions are like a herding dog for your sheep and stuff like that. It's not pets or indoor dogs. Um, it is by the wisdom of Allah that like calls to like and evil calls to evil. It is said that the Kafirs, Jews, Christians, and communists in the East and the West all keep dogs, Allah forbid. Each one takes his dog with him and cleans it every day with soap and other cleansing agents. But even if he were to clean it with the water of all the seas in the world and all the soap in the world, it would never become pure, because its impurity is inherent, and inherent impurity cannot be cleansed except by destroying it and erasing it altogether. But this is by the wisdom of Allah, and the wisdom of Allah is that like calls to like and evil calls to shaitan. Because of this kufr of theirs, it is by the inspiration of the shaitan and the command of the shaitan, for the shaitan enjoys evil, immorality, kufr, and misguidance. Kufr here meaning non-belief. So they are slaves to the shaitan and to their whims and desires, and they are also evil and love vile things. We ask Allah to guide us and them. So I thought that was an appropriate quote to start this video with, because we're going to be talking about zoonotic diseases caused and spread by dogs. So like he said here, even if you wash your dog every single day with soap and all the water of the seas, it will never become clean, because its uncleanliness is inherent, and inherent uncleanliness cannot be cleansed except by destroying it and erasing it altogether. I felt that was worth reading twice. Now, I'm not a Muslim. I have respect for Islam and Muslims. I'm not promoting any particular religion here. I just thought this was interesting that in this, I guess, hadith, uh, forgive me if it's not a hadith, I'm not entirely sure, but in this answer um, from this sheikh, uh, he just talks about the inherent impurity of dogs. Um, so the reason we're going to talk about this today is, I guess I'll just go ahead and share this. Um, this is a screenshot I took from this dog culture review YouTube community page. Um, I believe it was deleted, and I don't know the exact day this was posted at this point. It was, I think, last week sometime. And I honestly just ignored it, but I promised to post it late today, so I'm doing it now. So, this also exists in the anti-dog culture. I'm not entirely sure what even he means starting off, like what exists in the anti-dog culture. Um, yeah, I see people sharing my videos on their community pages and also shadow banning my responses. I even expressed gratitude in a few responses. Turns out I was muted, aka parentheses hide user from channel, aka me, Sheepy. Uh, I did hide him from my channel. I don't really feel the need to like justify myself, but essentially I just don't want to have interactions with individuals who behave like this guy does. When I first came across his channel, I subscribed. I thought it was another dog culture critic, might have some interesting takes. Um, Honestly, frankly, didn't watch 99% of the videos he posts, and the few I did try watching, I usually would just stop before they finished because a lot of the times I just found them hard to follow, or he'd kind of run off in weird directions with the ideas that I thought didn't really make sense. Again, I didn't criticize him or his videos because I just thought it was unnecessary to do, and frankly, I really didn't watch very many of his videos anyways. Um, I see the number one dog hating channel making covert insults toward me for my steel balls examination of politics that affect dog culture, and my analysis of how AI affects dog culture. Too bad. Your balls are owned by another channel that you suck up to in all your videos. Lovely. Kisses. I cringed even reading this right now. Uh, I really am kind of speechless, like, not even sure what to make of this. So clearly he's referring to IHD. I think it's weird that he thinks there's covert insults being made. I really don't think anyone really thinks that much about this guy until he has these episodes where he just kind of starts blowing up on people. Um, and this will probably be the only video I ever make. First and last time I'm going to even discuss this, but I just wanted to get my thoughts out there and share this screenshot that I took. In this live stream video, you claims that people cannot talk about politics with you. Uh, I think he's referring to I Hate Dogs live stream here. Um, I don't know that, like, I don't even know what to say. Well, how can you dictate what other talk about? Really? Answer that honestly, please. You said it needs to be a legit reason, right? Okay, according to who? But it is okay. In the wide perspective of things, this is of little value. Uh, but obviously it's of enough value for him to continue making these like unhinged multi-paragraph posts about IHD and Kanon. Uh, I think IHD is right in this, like some kind of clout chasing going on. I think there might be more going on than that personally too. Just, I mean, like this kind of behavior and attitude is just not something that I want to interact with. And I don't think most normal, well-adjusted people have a desire to interact with this kind of behavior. It's just off-putting, counterproductive. Um, I feel like it's not I feel like normal, well-adjusted men don't talk about their steel balls. I don't know. I'm not a man, but like that just seems really weird to me. Um, and I don't remember ever seeing anyone discuss this guy in a negative light until he popped off on people. So it's kind of like just it's just weird. I don't know what else to say about it, but uh recently he's really going off on this whole dentist office that has the dog um in the in the dental office as some kind of I guess service or therapy dog. I find it disingenuous to claim now that that's not an issue, or like your entire channel is comprised of videos critiquing dog culture, but now you're saying like it's a small issue and it's meaningless and you should just send like a PowerPoint presentation to the dental office in West Virginia explaining dogs to them. Like, I mean, I guess if you want to do that, but I feel like you're just going to come across as like an unhinged weirdo if you send a random dental office in another state, like a presentation on dogs. Um, Again, kind of the whole point of what we're doing is to have a discourse, have discussions, and share our thoughts in the way that each creator, each content creator sees fit for their own personal style, their own thoughts, their own opinions. Um, and also, I think just to share those thoughts and ideas with like a broader audience, a broader community. Um, so this kind of behavior doesn't achieve that. It's just, again, it's just weird. Um, I can't agree with a boycott on a business. I don't co-sign shutting down a business over, like, this is what's weird to me. Uh, and what I'm kind of trying to get at with this, like, these bizarre trains of thought. Like, at no point is this business getting shut down or even discussions of this business getting shut down. Um, I remember that I Hate Dogs has ran his mouth about how great AI voices are for protecting jobs, but he's happy to send Branson family dental workers to the unemployment line. Links will be in the comments. Links to what? I have no idea I don't understand even what this means. He's got this weird fixation on AI voices, which I think is just his way of personally attacking Kanon. Um, and it's just so like over the top dramatic. Like these people aren't going to an unemployment office anytime soon. Uh, because of one video on YouTube that a content creator made criticizing their inclusion of a dog in the office. Um, Again, this is just weird like this is just not normal. Your lack of awareness of this fact really makes me lose a lot of respect for you. You have an inspiration but an equal disappointment. Like even grammatically it doesn't make sense. Perhaps my fault for thinking your anti-dog content was truly pro-human. Is it? Like I'm not going to speak for I Hate Dogs, but like yes, literally like that's the entire point of all this. Like a dog being in the office, a dental office is not pro-human. Like you're exposing them to risk, you're exposing them to danger, you're exposing them to pathogens, allergens. I mean, in a dental office, you're leaning back in a chair with your mouth gaping wide open the whole time. You know what is floating around in the air when a dog is nearby? Uh, Running a hate campaign against a successful dental practice? A hate campaign? FYI, brother, Branson Family Dentist has been with us since 2010. Like, bro, you were unaware of the existence of this dental office until there was a video about it. Like, what are you gonna start being mad at anyone that criticizes dogs being in schools and suddenly start saying, like, you're gonna shut the school down? He's gonna get that, all those teachers are gonna lose their jobs because you don't want service dogs in the schools. Like I said, it's just completely insane. Send, maybe you can send them an apology? What? Like, to make a sentence like this, you would have to think in your mind that Branson Family Dentistry in West Virginia is aware of an I Hate Dogs video on YouTube that was just made. Like, it's just so detached from reality. I think this is what this is really about. He's just extremely mad that he might be losing subscribers because other content creators are getting a little bit like sick of his bullshit. Uh, Again, another rambling post that is putting words in IHD's mouth that were never even said. Like, since you're telling people to not visit the dentist, like, at no point was anyone advised not to visit the dentist. I think if there is any advice at all, it's to maybe choose a dentist that doesn't have dogs in the office. Again, I don't even want to go through all this. There was one other thing I wanted to touch on, which is somewhere around here. I think it's like a video, actually. Yeah, so I actually watched this one and it was truly unbearable, but I did out of morbid curiosity. IHD promotes tyrannical business boycotts on medical offices, hypocrisy in the anti-dog movement. Like, first of all, I don't think you understand what the word hypocrisy means because advising to boycott businesses that allow dogs in them because you don't like the presence of dogs is the most consistent position you could have. It's literally the opposite of hypocrisy. Um, and the main point I wanted to just give my opinion about is that a boycott is not tyranny. Like a boycott is an effective and legitimate form of protest. Um, Tyranny would be forcing people to go to the dog dentist. Freedom would be people being able to boycott a dentist that brings dogs inside. Like, it's just like his concepts are completely out of whack here. They're like almost reversed. They're almost like an inversion of the truth or reality. Um, Again, like I feel I'm feeling a little bit cringe even talking about this, but I think some of these things need to be said because I am a firm believer in quality over quantity. So just because there may be a channel out there that criticizes dog culture, um, if it's the rantings of someone who is unhinged, hostile, and confrontational, like I'd rather have less dog critic channels that are high quality than follow every single channel that says they don't like dogs sometimes but mixes it in with a bunch of just bizarre nonsense and then tack on to that like attacking people, being hostile, making weird obsessive posts about others. Like, you can just make your own videos. Like, you can just make your own content. Like, and if you're only getting, like 10 likes or like maybe focus on making, more appealing content. Uh, I mean, I feel like this whole rant is about I hate dogs because he's now convinced that IHD is like trying to, yeah, he's like obsessed with putting words in other people's mouths that they never even said. Like, it's just weird. So, again, another just long ranting post claiming that there's some blanket, as if like I Hate Dogs is like the dictator of the dog critic space. It's like again, it's just a bizarre. Uh, I mean, don't wonder why I've muted this individual, and that's I think all I'm gonna say about that. So, actually, the last thing I'm going to say about that is I want to bring people's attention to something called the Dunning-Kruger effect. Um, the Dunning-Kruger effect is a cognitive bias in which people with limited competence in a particular domain overestimate their abilities. According to metacognitive explanation, poor performers misjudge their abilities because they fail to recognize the qualitative difference between their performances and the performances of others. So essentially, it's a psychological phenomenon where people with low ability in a specific area give overly positive assessments of their own ability in that area. It's a form of cognitive bias. Um, so, here's a quote from one of the guys behind this. Not knowing the scope of your own ignorance is part of the human condition. The problem with it is we see it in other people and we don't see it in ourselves. The first rule of the Dunning-Kruger Club is you don't know you're a member of the Dunning-Kruger Club. So I'm just going to leave it at that. All right. More importantly, I want to go over why you would want to boycott a dentist or other medical office that is bringing their own personal mutt into said office. Um, I support boycotts. I am a fan of boycotts. I think boycotts are effective. I think they're legitimate. I don't think they're tyrannical. Um, I'm a big supporter of BDS, which is the Boycott, Divest, Sanction movement, which tries to boycott uh, goods or, um, you know, excuse me, items that are manufactured in Israel in protest of their treatment of the Palestinians. So I ideologically support the concept of boycotts, and they are clearly, I mean, even in the realm of like protest, uh, a very peaceful, nonviolent act of protest that is effective because, like, the worst thing that will happen to that dental office is people boycott over the dog and they remove the dog. They're not going to fire everyone and shut the office and send them to unemployment lines. Like, that's just an insane take. It's just a bizarre, over the top conclusion to come to. Anyways, this article from the Journal of Medicine and Life looks like was published in 2015, and it's a review of bacterial and viral zoonotic infections transmitted by dogs. So, dogs are a major reservoir for zoonotic infections. I actually feel that this is probably a vastly understudied truth. Um, Dogs transmit several viral and bacterial diseases to humans uh, through saliva, aerosols, contaminated urine or feces, and direct contact with the dog. We all know about rabies. Norovirus, I think, is an intestinal infection, bacterial infections, of which there are many, including that MRSA, which I think everyone has heard of, methicillin-resistant Staphylococcus aureus. That's the staph infection that is, very difficult to treat with standard antibiotics. It's an antibiotic-resistant bacteria. And these are the most common viral and bacterial zoonotic infections transmitted to humans by dogs. Again, if you're in a clinical setting, a medical office, you're probably already, sick. Your immune system's compromised in some way. You're suffering from some sort of illness, like your body is already under stress. And now you're potentially introducing this long list of bacterial infections that are transmissible from dogs to humans. We already know MRSA is a huge problem in hospitals. A lot of people go to the hospital with one illness and end up contracting MRSA. Do you not think that introducing dogs to that environment could uh, increase that risk if dogs are carriers of MRSA? So basically, this article goes through these various zoonotic diseases. It's estimated that over 60% of the Western families own a pet. The majority of these households keep a dog. Dogs have been kept as pets for over 14 centuries. Every single study you'll ever find of the few that are done on any negative consequences of dog ownership always throw in these caveats about how actually dogs are great. They have a precious role in human life. They boost your health in different ways. Um, so I just feel like it's interesting that they always have to like couch what's coming next with like, oh, but dogs are really good. So they do say, I don't agree with this, so I'm not even going to read it. Many diseases among humans are attributed to dogs. Children and immunocompromised individuals are especially at an increased risk of developing zoonoses infections. Several studies demonstrated that domestic dogs have a dramatic role in developing zoonoses disease and hospitalization. Regarding domestic dogs, the increase in the population of stray and semi-domestic dogs in urban areas has increased the risk of zoonoses diseases. About 5 million people throughout the world are annually bitten by dogs. I feel like that figure should be much higher. Many parasitic and zoonotic pathogens are transmitted by dogs. This review focuses on the most important viral and bacterial zoonotic diseases which can be transmitted by dogs. Obviously, number one here is rabies. It's essentially 100% fatal. By the time you show symptoms, it's pretty much over for you. Noroviruses, um, yeah, they cause gastroenteritis in humans. This is, you know, stomach uh, stomach pain. You're gonna have diarrhea, all that sort of thing. Pasteurella is um, a bacterial infection. It says these bacteria are normal flora of the upper respiratory tract of dogs and cats. It can be transmitted to humans by direct and indirect contact, um, such as dog or cat bites, licks, or even scratches. Several infectious diseases in humans are attributed to this bacteria. Um, Meningitis, bone and joint infections, and respiratory infections can be transmitted by this bacteria. And a prospective study in the United States, an author demonstrated that Pasteurella was the most frequent organism isolated from dog and cat bites. Salmonella, we know that's serious. That can be fatal, from what I understand. Not all the time, but you know, salmonella is not something you want to get. Brucella. Brucellosis is one of the most prevalent zoonoses, which imposes a heavy burden on the national health services. This is another thing that's not focused on enough. I'll probably make more videos on this, but just the resource drain that dogs are on the medical system itself. Um, Again, when you have what is it called? Super bacteria? No, I think that's the wrong term. I think there's a term for these. There's a growing number of bacteria that are resistant to the antibiotics that we commonly use, MRSA being one. Um, so let's see. There is literally a version of this bacteria, Brucella, called Brucella canis, and it said that the reported cases were more often seen among farmer populations who had a history of exposure to body fluids of dogs. Excuse me. Um, Yersinia enterocolitica, um, Campylobacter, Caphnocytophaga is one that we've all heard of. It can be very serious. The pathogen is mostly transmitted to human by dog bites, and causes an overwhelming sepsis. Sepsis is a severe issue. It's a deadly issue. It's often not treated. Um, it's not detected and treated early, so it can spiral out of control really quickly. Particularly in elderly, immunocompromised, or asplenic patients. This comes up in another article. People who've had their spleen removed can be especially susceptible to zoonotic diseases transmitted by dogs. Yeah, this is pretty serious. The literature data have demonstrated that the mortality rate due to Capnocytophaga septicemia is estimated to be of 1/3 of infected patients. Bordetella, I'm not sure how to pronounce that one, but it causes Q fever. I think I opened a page on that. Yeah, rare illness caused by this particular bacteria. Flu-like illness, severe headache, chills, dry cough, weakness, muscle aches. Chronic Q fever can cause damage to the heart and other organs. So again, these are no joke infections. Leptospira is a major cause of leptospirosis in humans. It can cause diarrhea, nausea, vomiting, alveolar hemorrhage, and even meningitis. Another staph bacteria, again, here they talk about MRSA individually. It's a major cause of fatal infection in humans. Companion animals were the main reservoirs for the transmission of MRSA. Um, Companion animals here, I'm going to go ahead and assume is primarily referring to dogs. Here's another paper from 2017, Exposure to Animal Feces and Human Health, a Systematic Review and Proposed Research Priorities. So I've searched for dog throughout this article. There's 14 occurrences, and it goes through many of the same pathogens we just covered. Dogs were most likely to be associated with soil transmitted helminth infection. That's a worm, so you're going to get worms from soil contaminated by dog feces. Um, Exposure to dog feces is a pathway for these diseases. Now, it does mention, many other domesticated animals, but the vast majority of Americans, which is what I'm mostly talking about here, are not coming into consistent contact with goats, sheep, pigs, buffalo. Uh, you know, people have guinea pigs and rabbits, I think, but really all of these things are to a much lesser extent than dogs. Also, more importantly, people who are coming into contact with goats, sheep, these other animals, guinea pigs, rabbits, these aren't the animals that are being brought into every public space, right? Only one animal is on a daily basis being brought into virtually every public space, and that, of course, is the dog. Um, that's why critiquing dog culture is important. That's why boycotting, where you can, businesses uh, that do this is a good action, a good move. Even even just for your own personal benefit. But if people started doing this more in mass, um, that kind of thing could actually have an impact. Um, so positive associations were found between seropositivity for helminths and soil contaminated by dog and cat feces in households and public settings. Examples: parks and playgrounds. Stray free-roaming cats and dogs contaminated domestic and public environments with toxoplasma and helminth eggs in rural and urban communities. Again, this is primarily a dog issue. I don't think I've ever seen someone bringing their cat into a grocery store. I've never seen bring your cat to work day and there's a bunch of cats running around an office. I've never seen a cat in a dental office. I've never seen cats in hospitals. I don't think I've ever seen a cat in an airport. Now, I'm not saying people don't take cats in airports. I'm just saying when I travel, every single time recently that I've traveled, I've seen a number of dogs in the airports, on the airplanes. Um, so this is a dog issue. And here, reducing contamination of environmental sources by controlling animal movement. Soil is oftentimes a reservoir for animal feces contamination in both public and domestic areas, and animal containment measures may reduce animal fecal contamination. In urban Brazil, fencing around public sandboxes was a significant protective factor against soil contamination of helminths from dog feces because the fences prevented stray dogs from accessing the area. We have a problem in this country with dogs not being contained and controlled. Dogs coming into public spaces, dogs coming into hospitals, dogs coming into grocery stores, dogs sitting in grocery carts where you put your food. Um, so here's a description of Toxocara canis, which are parasites of the domestic dog. It can migrate to your central nervous system and cause eosinophilic meningoencephalitis. Death can occur in instances of severe cardiac, pulmonary, or neurologic involvement. Um, let's see. So these, okay, this is viral. Oh no, a visceral larva migrans, um, and ocular larva migrans. That's the main clinical presentation of this toxocariasis. So I guess this is some kind of parasite. Um, in VLM, which occurs mostly in preschool children. So again, you're bringing dogs into schools, you're having kids read to dogs, they're being exposed potentially to these zoonotic infections. So in this case, the larvae invade multiple tissues, commonly liver, lung, skeletal muscle, and occasionally heart tissue, and cause various nonspecific symptoms: fever, myalgia, weight loss, cough, rashes, hep- hepatosplenomegaly. I think that means perhaps an enlargement of the spleen. I'm not positive. Again, serious issues. Um, and I imagine that with this type of clinical presentation, it's probably going to take a while before a doctor is actually going to check to see if you have, parasites. They're probably going to treat your fever, treat your cough, treat your rash. Like, that's the problem with sepsis, too. Oftentimes, it's not recognized early what the actual cause of these symptoms are because they're not, like this says, they're non-specific symptoms. So you could have a preschool child suffering from the effects of these parasites for potentially a long time until, serious damage is caused to these tissues. So imagine you're in preschool and some nutter is bringing their dog to your school all the time. You end up getting infected with some kind of parasite and have to spend the rest of your life with liver, lung, muscle, or heart damage because it wasn't diagnosed correctly in time. Here's another one. Um, this particular infection often remains asymptomatic for years before the cysts grow large enough to cause symptoms in the affected organs. Hepatic and pulmonary signs and symptoms are the most common clinical manifestations, as these are the most common sites for cysts to develop. In addition to the liver and lungs, other organs such as spleen, kidneys, heart, bone, and central nervous system, including the brain and eyes, can also be involved with resulting symptoms. Rupture of the cysts can produce a host reaction manifesting as fever, urticaria, eosinophilia, and potentially anaphylactic shock. That can be deadly. I think this typically requires treatment with an EpiPen, basically, epinephrine. Um, Rupture of the cyst may also lead to cyst dissemination. It affects the liver as a slow-growing destructive tumor, often with abdominal pain and biliary obstruction being the only manifestation evident in early infection. This may be misdiagnosed as liver cancer. Rarely, metastatic lesions into the lungs, spleen, and brain occur. Untreated infections have a high fatality rate. Another version of this affects mainly the liver, where it's a slow-growing tumor, and secondary cystic development is common. So, again, another article, might have looked at this one already. Yeah, we looked at this one already. Here's a 2015 article, diseases transmitted by, again, they have to put this in here, man's best friend. Is an animal that is one of the most common reservoirs for zoonotic diseases that can cause life-threatening illness really our best friend? This should be present in 60+% of households and doctors' offices, dental offices. Um, this is going to go through many of the same ones. Um, Again, it has to put this caveat in how, oh, no one would question the merit of the long history of valuable service that dogs have provided to humans. It's the stuff of legend and literature. We have evidence that they're good for our health. Um, no, I disagree. And it's just bizarre to me that you would start an article about diseases um, with how great dogs are. I just find that very strange. Uh, and this even admits that considering that there are an estimated 83 million pet dogs in the United States, physicians need to be familiar with the potential illnesses that can result from canine exposure. An inquiry into animal contact, really dog contact, is an important part of a medical history. I think up here it even said if you have HIV, you need to check for a specific cryptosporidium. Oh yeah, also I wanted to mention this. Evidence exists that the family dog may serve as a reservoir for uropathogenic Escherichia coli, which E. coli, that can lead to urinary tract infections among human household contacts. So, I mean, these things are, it, it's not an exaggeration to say that these things are disease spreading, uh, illness, reservoir. I mean, these are dogs are just a reservoir for serious disease causing pathogens. And I mean, this guy's not even saying, oh, you need to watch out for like a stray dog here and there that might have some of these uh, bacteria. No, they're saying a lot of these bacteria are a normal part of a dog's, bodily uh, fauna or whatever, flora or fauna or whatever. um, I mean, it just goes, look how many. Look at this table. I mean, how many physicians do you think actually like consider this? Have you ever been to a physician that asks you, do you live with a dog? Are you exposed to a dog? It's important for me to know for your medical history whether or not you have a dog in your household so I can see, if any of these clinical presentations match with these uh, pathogens. I have never one time in my life been asked by a doctor if I had come into contact with a dog. I do not believe that physicians are uh, in general familiar with the potential illnesses that can result from canine exposure. I really don't think that. Maybe it's covered briefly in medical school, but if you have doctors, dentists bringing dogs into their clinical practice, into their space that should be like very sterile, very clean, I find it hard to believe, unless they have serious cognitive dissonance, that they're aware of this. If they are aware and are bringing their dogs anyway, that seems like malpractice to me, or like um, negligence or recklessness. So, if you have a local infection after a dog bite, it could be any one of these uh, pathogens here, several. You might have uh, ringworm. So these are okay. So the table is showing the clinical picture for uh, these rows correspond to skin and soft tissue. Some of them are associated with infections caused by a bite. Other things include ringworm, puritic papules, creeping eruption, erythema migrans. If you're having issues with lymph nodes, it could have to do with these pathogens. If you're having respiratory issues, it could be caused by these pathogens. Gastrointestinal is a very long list. hepatitis, hepatomegaly, arthritis. We have here a list of neurological issues. Here, systemic issues, including septicemia, endocarditis, and here's a couple that fall under the category other. So, visceral mass, um, eosinophilia. So here it says animal bites are a major public health problem and account for. Oh, but I thought at the beginning of this you were saying how dogs are so good for people's health. It's so tiresome. A major public health problem and account for about 0.5 to 1% of emergency room visits. Dogs responsible for 75 to 90% of reported bites. 5 million people in the US alone suffer a dog bite each year. Approximately 15% of these require medical attention. I think those numbers are low because a lot of them aren't reported. I think this number should be higher. In most instances, the dog belongs to the bite victim, a friend or neighbor. One half to two-thirds of bites occur in children, with a peak incidence in those 5 to 9 years old. In adult life, people who come into contact with dogs more frequently have a higher bite incidence. Um, Half of the bites in children involve the head and neck. So here it says the oral flora of the dog is complex, plentiful, and made up of many aerobic and anaerobic species. Uninfected bite wounds should not be cultured since they typically grow multiple species. So you have to wait until the bite is infected to take a sample to culture to figure out which of the many bacteria is causing your infection. Most infections, I feel like that's a little bit of a contradiction, but most infections following a dog bite are polymicrobial, typically yielding 5 or more species on wound culture. Common organisms are, we talked about this one before, Pasteurella, strep, staph. There can even be a chronic cutaneous infection with a fungus. So dogs are out here running around with fungal, with the ability to cause fungal infections. But no, you shouldn't boycott a dentist that has your mouth wide open near one of these things. Um, it just goes through preventing, we know that's not possible. The only way to actually prevent a dog bite is for there not to be a dog present. Like, literally, the only way to prevent a dog bite is to stay away from dogs. Um, this one is serious. So, dog bite septicemia. Capnocytophaga canimorsus is a fastidious gram-negative rod which can cause serious systemic illness following a dog bite. Since it was first reported about 40 years ago, more than 125 human cases have been described. I feel that, again, this number is probably low um, versus the real number of instances because I'd like to know. I would just like more research to be done on this to see like, are they testing? Are they in cases of septicemia? Are they always identifying the pathogen that's causing it? I don't know. Just a question I have. This could be accurate. The bacterium has been isolated from the normal gingival flora of 70% of dogs. This is part of their normal mouth bacteria. 70% of dogs just have this bacteria in their mouth. More than 75% of cases involve previous exposure to a dog through either ownership or a bite. The clinical illness is typically one of severe septicemia, shock, and disseminated intravascular coagulation are common, with a mortality rate of about 30%. Oh my gosh. So other manifestations include cellulitis, which can be very serious. I think you can lose limbs from that. Gangrene, you can definitely lose limbs from that. Arthritis, endocarditis, brain abscess, rash, hemolytic uremic syndrome, thrombotic thrombocytopenia, no, thrombotic thrombocytopenic purpura, purpura fulminans, adrenal hemorrhage, myocardial infarction with normal coronary arteries. That's a heart attack without evidence of endocarditis. So you're just, it causes a heart attack without you having any, I guess, coronary arteries, or you have normal coronary arteries and no evidence of endocarditis. So you have a healthy heart, but it causes like a heart attack. Mycotic aortic aneurysm, mononeuropathy by occlusion of vasa nervorum, and infarction of the nerve. Again, it mentions this Q fever, rabies. I mean, we don't have to go back through all of the um, pathogens we've already covered. Here's the signs and symptoms of Q fever. Have you ever even heard of this? Like, I've never heard of this. Do you think most doctors are aware of this? Are they asking you if you have fever, chills, fatigue, headache, muscle aches, if you've been exposed to a dog recently? It can lead to pneumonia and hepatitis. If you're infected during pregnancy, you could be at risk for miscarriage, stillbirth, preterm delivery, or low infant birth weight. Some people can end up with chronic Q fever, which can cause an infection of heart valves, and they can experience night sweats, fatigue, shortness of breath, weight loss, swelling of the limbs. It can be serious and can be deadly. So, I mean, dogs are filthy, like the quote I started this video with. Their filth is not something that can be washed off. These pathogens are a normal part of their bodily fluids. You are risking exposure to capnocytophaga 7 out of 10 times that you interact with dogs. 7 out of 10 dogs have capnocytophaga. It could be more. I mean, that's just according to that study. 70% of dogs sampled had that present in their saliva. So I wanted to finish this video here stating the obvious. Homes with dogs versus no dogs. Dog-free homes are always way cleaner. I feel like this goes without saying, and I think that applies to any kind of clinical setting. A dental office that doesn't have a dog is going to be way cleaner than one that does. You should avoid medical offices if you can that allow dogs inside. MRSA is already an issue, and dogs are a reservoir for MRSA and can spread MRSA. I mean, imagine if you're in a hospital or even a dental office, and every patient in there has been coming into contact with this dog, petting it, rubbing on it, whatever. You think it's impossible that that dog could be spreading MRSA, like room to room or patient to patient? I think it's very possible. I think this is a good point. So, as soon as the dog leaves the home, it becomes cleaner. It's not even that it becomes cleaner, it just doesn't get as dirty. Dogs are filthy and their presence leaves hair, urine, feces everywhere, intense nasty odor, slobber, anal glands. Yeah, this is another really good point. It's not just homes, it's also anything you buy that comes from those homes. I remember I got a pair of designer heels from a home with presumably dogs. It had tick sheddings in it and fur all over. I actually avoid buying things used at this point, um, mostly because I am concerned that they're coming from a dog household. Some of that stuff leaves a stench that you just cannot wash off. Yep, so that's it for me tonight. Thanks for listening.